Okay, well, welcome back to this product demo for the DSD-863 with methadone. We're showing you now the saliva indicator partially turned blue, but there has already been sufficient saliva absorbed to run the two test line membranes right up until the control line. Hasn't completely turned into a white background yet, so what you will see, the saliva indicator is quite slow to change in these tests. That's as a safeguard to ensure that you've really saturated and collected more than enough saliva in that membrane to run all these tests. But as you're getting the blue coloration increasingly come over that yellow indicator for the saliva, that once you've got the control lines run, you can remove it from the oral cavity and put the cover back on. Now if we just run you through the results here, you'll see this is whitening up. We're approaching the read time of between 5 and 10 minutes. You'll see two nice distinct clear C lines showing that adequate saliva has run through all the test line areas, and then you'll see these test lines forming against all of these 6 drug group abbreviations: OPI for opiate, COC for cocaine, AMP for amphetamine, MET for methamphet, THC for cannabis, and MTD for methadone. And you'll see the test lines that are formed against the opiate and MET membranes are dark and thick. The test lines that are formed against the other 4 are thin and faint. But this is an entirely normal phenomenon with these saliva and other drug tests. You will see variation in the test line. Any line formation at the correct read time in the presence of a control line is a clear negative result. Do not try and interpret any level indication or other significance in the thinness or faintness of a test line. It has to be interpreted as a clear negative. This is a normal phenomenon for urine and saliva drug testing. You'll see this variation. So there you have it, a nicely run 6-panel saliva drug screen giving you an all negative final result on that sample. These are available from the UK drug testing and ValueMed websites.